Friends and colleagues, it is my great pleasure to welcome you to Montecatini Terme, to the ISCOME 2015 conference. The literature shows us that patient safety improvement attempts to this date have not really affected the change that we would like to see. So there's an implication that the healthcare field cannot seem to be resolving this problem on its own. So with ISCOME, we're trying to endorse interdisciplinary collaborations to make this happen, and this is what the bridge stands for. So bridging across disciplines to kind of create innovative implementations and innovations that would make this happen. The golden implies that communication really is the bridge to making that happen. We have seen that if communication fails, patient health is put at significant risk, and if communication goes well, we're seeing significant healthcare improvements. So golden stands for communication as being the route to making that happen, and the bridge implying transdisciplinary innovations to get there.
No one ever said it was going to be easy.
So it's one of the few instances in which we're trying to directly connect communication behaviors in process to patient safety.
Things that doctors do that cause mistakes and are threats to patient safety.
But what they found is that 2/3 of those errors could be traced to an initial communication problem.
This is where communication allows me to extract that information. And how good I am at extracting that information is going to dictate how good I am as a physician.
Is that good communication or not?
We think of skills as something that I possess, but skills are always enacted interactionally.
In general, the people who focus on education and who focus on training are not always the same people who focus on evaluation or measurement or generating evidence so that the rest of us know what to do.
We need observations of actual interaction, naturalistic interaction in the healthcare provision context.
I am of the opinion that we really need to develop capabilities such as sympathy.
So is it something we do, or is it something we achieve? That is, you do not have patient-centered communication until you've accomplished the communicative goals consistent with patient-centered care.
Is patient-centered care and communications as a core aspect of patient-centered care.
With patient-centered communication, and specifically in that domain, the more that the physician gives choices to the patient, the more uncertainty the patient leaves with.
So what's the key to success there? The key to success is that patients are going to need to speak up, but they often don't.
Communication around the prevention of errors to be not just dyadic between the patient and the clinician, but also to include that very important family member.
They disassociate in order to stay alive. And that is what's happening to patients who are abused within the medical system.
We need interdisciplinary collaboration so that we can bring people from perspectives that bring things that we don't have in our own perspectives. And we need funding, data sharing, and initial pilot studies so that we can go to funding agencies and say, here's what we can do. Here's evidence that we can get at this phenomenon.
It is my great pleasure and honor to be able to welcome Sir Liam Donaldson to ISCOME 2015 as our final plenary speaker of the conference.
It has not yet moved too much beyond the domain of enthusiasts and academics like ourselves. If an organization is very resilient, then it makes a strong response to a weak signal of failure.
One of the things I really gain from this association and being at a conference like this is learning how people from different disciplines and indeed different countries look at a particular subject and getting a sense of the different theoretical frameworks and the insight these different frameworks and models bring to a subject that I thought was, actually, yes, there are big implications from that particular thing.
We started this initiative in 2013 with a conference, COME 2013, in Switzerland, in ISCOME. Back then we had approximately 85 participants with about 20 to 25 paper presentations. 2 years later, we have now had almost 150 participants from 17 countries attending this conference to contribute their knowledge to date from various disciplines, including healthcare, communication science, public health, health-related fields, but also psychology, the legal fields, and the frontline court of companies and industry that are represented in this field. So this alone shows that people are getting on that train of believing that interdisciplinarity is needed. Also, what we're doing now that we have been founding the society out of that initial work group, we are implementing a 3-day workshop the upcoming days after this conference, which starts tomorrow, to actually affect 3 different tracks of research that should be implementing the knowledge and the discussions that we had during these past 2 days. So on one track, we're engaging for 1 day in knowledge integration. So we have the different disciplines present to take existing theories, existing empirical evidence, and calibrating them into medical guidelines that we could use as a foundation for improving care. On another track, we're engaging in data sharing. So on the second day of this workshop, we're going to be taking existing data sets from the different disciplines and shed interdisciplinary light onto those to reinterpret them, to add interpretations that have not been taken into account to this date. And then last but not least, and probably most importantly, on that last day, we will be engaging in collaboration with a fundraiser from the European Union in developing new data that start with transdisciplinary integration at its seat. So to generate data that are interdisciplinary in nature and have to optimize the likelihood that implementation will be successful. So we are a young yet dynamic and very driven society that engages in active research to affect implementations on levels of practice as well as levels of education. And we hope that many will join us to affect this change.